Hi, I'm Art Bailey, and this is the postural correction system. The purpose of the system is to take the body, bring it neutral to gravity, so a bag of water stands against gravity with less pressure. That's why things hurt. The bag of water collapses to gravity. We are an oxymoron. We should be a blob. What holds us against gravity is connective tissue, which the collagen molecule, the strongest structured body, makes a little tube, a fibril. And it's full of fluid, cranial fluid. It builds you like Legos from the bottom of your feet to the top of your head. Has a hard shell around it. They call it fascia. Has lines that go through it. They call them myofascial bands like barrel hoops. Has lines that go from head to toe and that twist through you. And with that structure, you have a flexible blob. And you look like the Michelin Man. Now you add bones for superstructure. And you add muscles, which are little ratchets that break a molecule, that's your energy molecule of life, and move the gristle. We call it gristle. Gristle is that stuff you don't eat, that nasty stuff under that chicken you don't eat. Except for one guy I knew, that was disgusting. Consequently, it's the mesoderm. In the beginning was the gristle. We call it fascia, ligament, cartilage, scar tissue, fibrosity, lesions. Difference between a lesion, piece of scar tissue is $200. So the way the body works is a bag of gravity, which is the water, collapsing within itself. The body morphs with connective tissue, doesn't stretch, it morphs like a piece of plastic and taffy, changes shape. Knowing that law, that it does it in 5-minute increments, because it's a law, so 5 pounds, 20 pounds, it doesn't move for 5 minutes, it's a union job, you know. Consequently, you just wait. Add a little bit of leverage to it, like the postural correction system. Put that bag of water against gravity, and like sticking a board in a jig, it comes out straighter. Praise the Lord. It's only going to stay straight so long, obviously. But my goal is, how little can I do? How often don't I have to do it? How much can I get out of it with how little bit of effort? Let's be honest, I'm tired at the end of the day, and I don't want to get on the floor and do it, because if I wake up on the floor, it's just a feeling you just don't want to know. You don't like waking up on the floor. Consequently, get your cheap massage table, put it next to your bed, roll off into your bed, or make your bed stiff enough to where you can do it. Don't tell me why you can't do it, just do it. So, all the great minds got together, and I borrowed from them, because I'm German, we can do that, see. What do we have? Well, we have an isometric exerciser that's magnetic, based on Joseph Pilates' work, magnetic. The isometrics is proven now to strengthen the blood pressure by reducing it, strengthen the arteries, strengthen the entire arterial system, reduces nitrous oxide. How cool that is. We have a pillow that tractions your neck. The secret is the rope. Place the memory foam together, the energy keeps opening, the rope molds to the base of your skull, and you have a traction machine that adds about 2 pounds of pressure. Why 5 pounds, 20 pounds if it doesn't move for 5 minutes? Take your time, talk to Jesus, just lay there. It works on a dead board. A dead board, you know, you can lay it upside down, it's above a bed. Hey Bubby, I can change the shape of this board without touching it. Yeah? Take that bed, let's lay it right here and get coffee and come back in a couple of days. See if that board's not a little straighter. Gravity doesn't care, doesn't go to sleep. Again, we have a multifunction thing. I like the Runco concept. Here we have an isometric exerciser, we have a magnetic roller, and we can put it next to our head and induce a magnetic induction to stimulate the neurons, all FDA-approved concepts. We have a microwavable heating pad with silicone in it, so we can break the law, don't lay on heat. You can if the heat dissipates. If it does not dissipate, it will hurt you. Don't lay on heating pads that keep generating. You can roll this up with silicone and make a round rock out of it. We used that for years before we went to magnetics. So if you're adverse to magnetics, make a round rock out of this one. For the shoulder bolster, you can still use the pillow. We have a face down for therapists, a more professional model. This allows us not to have to use a face rest. Gives you a breast area, gives you a nice solid collar bolster. We have the new Dragon Staff, which has a magnetic device, which of course is our isometric exercise, and now we're going to use it to make electromagnetic movement through the body, stimulate our nervous system, make us heal a little better. Then we have a standard model for most ladies. and just a general thing without magnetics. So you can make it as strong as you want. Now we have a new shoulder bolster that replaced from the original 8 years ago, the microwavable pad that rolled up. What's inside of that is this magnetic core, this huge magnet. These are not inexpensive. The price will go up 4 times last time I looked when we run out of this inventory. Can't help it, the prices are. The smaller ones double as SOT shims and sacral wedgie. Now our sacral wedge fits male or female. You don't have to mold a different one to it. And it uses magnetics for muscle relaxation. Then we have a wedge, a standard 8-inch wedge. Hospital grade, holds up some of the big beefy people. And we have the new grounding system that has 3 patents on it. It was patented originally for wound care, stimulates the neurons in the body to excite. It creates an analog signal to the cells to stimulate healing, acts as an anti-inflammatory, but the side effect we found is it makes you sleep better because it's a muscle relaxer. So we're going to use the ancillary effect. We don't claim any of the patented components of this device. Another one is a magnetic pain reduction band. So you have 3 patents here. Altogether, if you look at the concepts, there's up to 7 patented concepts and different variations of which we don't make any claims. So we're not breaching patents. We're just combining concepts. We say if you lay on this, you're going to feel better. We won't claim that it acts as an anti-inflammatory, makes you heal twice as fast, pulls out free radicals out of your body. We won't claim that it decompresses your low back and opens up sacral decompression. We won't claim that it decompresses the thoracics and opens up breathing, improving lymph fluid. We don't claim that it creates cervical distraction, opening up the blood flow to the top of the head. And we don't claim that it gives you magnetic induction to stimulate neurons and bring you out of depression. We don't make any of these claims. We don't even claim that the isometrics drops your blood pressure. We just say all this stuff is proven by someone. We just make it better. We're Germans. We take everybody's and make it better. Now we're going to give it to you. So this is the postural correction system. Very inexpensive. If you use it, it will work. It will change your life. It will take you from misery to a better quality of life. Why does it hurt? Let's not be stupid. A nerve is a gas hose. When it leaves your spine, where the brain is, it's a hose. It's for little bags of gas. And that gas comes out or turns on a switch and says, oh, that sucks. Oh, I'm sorry, draws a vacuum. BPC correct now. So if you squeeze the hose, the gas comes out and says, ouch. If you pull the hose, it gets thinner and the gas comes out and goes, ouch. Or if in your mind, you're a little bit masochistic and you say, oh, hurt me, please. And sodium, potassium charge that nerve. They go like little magnets to the end, and that magnetic impulse pulls in the calcium and punctures the gas bag. It comes out and goes, oh, I told you that sucked, but please do it again. So now we know why we hurt. That nerve has a sleeve in which it travels. The connective tissue molds and shapes to the body, and it glues that nerve. So every time you move, ouch, 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 ouch. Or if you squeeze it, you get burning, pins, needles, and numbness. And finally, you're out of gas. Kind of like the story about my Aunt Clara's dog. What, her dog was her cat. And we filled the cat full of gasoline, and we let him go as David Johnson on. He ran all around Aunt Clara's house, and passed persimmon trees, and came back in, just fell over dead in the yard. Well, you thought. And David says, oh, God, man, where are we going to bury that thing? Why? Well, he's dead. No, he just ran out of gas. And you'll never forget that a nerve is a gas hose. So quit squeezing my hose. Thank you very much. And that's what this does. Elongates the body. Expands you. Like when the great structural integrators said, get them straight. If they quit hurting, that's their tough luck. Now what else can you do with this unit? You can exercise, laying in bed, burn your abs, do no sit-ups, get cardiovascular improvement, extend the dural tube, pull back the bladder, uterus, and prostate, everything back in place, and do it all in bed, because I don't want a Jane Fonda workout. Praise the Lord, I'm tired. That was cute when she was young. We saw her in Barbarella. They were all cute back then, so were we. Now we just want to get the kicks out of our butt and get a good night's rest. If you do what I'm telling you, you can turn off crippling pain. If it's not bleeding, broken, or infected, you can help it. If you do this, it doesn't help you, give it back. Obviously, we lied. Anyway, this is the postural correction system. Years of accumulation of different thoughts. We're going to show you how to use it. And for therapists, we're going to show you how to apply different concepts to it. So let's get on to that. Thank you. Okay, continuing on from that we've done the introduction to the pneumopostural correction system. The important things we want to leave you with, don't die with it in your head, is what I tell people. How to turn off your back. One position release that was formulated by Lawrence Jones will turn off migraine headaches, menstrual pain, panic attacks, 80% of back pain, including that from full-blown rupture. You will want to know this, because when your back goes out, you can lay on the ground and literally die, and don't touch me. You can go on morphine for 3 days, you can get epidurals, you can get fusions and still not be out of pain, or you can do some of this. Yes, it's not comfortable, but yes, it does work. Trust the physics. So, before you do any continuation of exercise, always recalibrate your back. Take the pressure out, make it reset, and that starts as a good place for the entire body volume to lengthen. We're going to accomplish that now. It's going to come in, and you'll be lying on your back. We'll take the pillow, put the magnetic core inside of it, so that we're using the magnetic induction. Place it underneath your head. Pull on the ropes so that the ropes mold to the base of the skull. Place your hands upon the abdominal cavity. You can lay on heat, but you cannot lay on it very long, or it will make you swell. So don't use a heating pad. You can get away with using something like the microwavable heat, because it's going to dissipate. So in this position with traction in the neck, we've added a ground. If you're having any type of cramping, you want to test instant muscle relaxer, a little jar of vinegar, a little bottle, apple cider vinegar, quarter teaspoon under the tongue will stop any cramp. It automatically breaks the sodium-potassium charge on the nerve and turns it off. And it's sublingual. Hold it for 60 seconds and spit it out. You don't have to drink. Consequently, it's a good test for muscles. When in doubt, vinegar. Headache, back pain, panic attack, you name it, even tachycardia. Try the little vinegar trick. Keep it in your purse. Doesn't matter. It doesn't go bad. What? It's going to turn to vinegar? Consequently, keep it with you. To turn the back condition off, you must get the legs all the way up. But before you do that, you have some options. If you have the availability, get you a couple drinking bottles of water, microwave them, and place them hot into the groin region, across the inguinal margin. The muscle that's hurting you is coming down your back. It's the primary flexor psoas. This muscle literally is locked up neurologically as much as with connective tissue, and it's causing the pressure in the low back that blows the discs and causes you all that misery. Very often there's a lesion that forms, a piece of scar tissue, right in between these two muscles, ligus and psoas. They're a conjoined tendon, supposed to work independently, except when you have to jump away from a snake, and then they work together. If they fuse together, they'll twist your spine. All kinds of fun stuff comes out of that. So turn your back off. Bring your legs to maximum fetal. I've had people say, oh, it hurts so bad I couldn't get my legs up there, and they went to the hospital on morphine drip for 3 days. Could have come out with staph infection. I said, did you pass out? Well, no. That's your get out of jail switch. If it doesn't make you pass out, get your legs up and turn your back off, or just live with your ignorance. Obviously, you don't know. This will kill the signal. Poof. When you do it right, it will be, my gosh, I'm out of pain. If it still hurts, you move left or right to decrease the pressure in either psoas till there is no pain. If it hurts, you're in the wrong place. Finally, move all the way back until there is no pain. In this position, talk to Jesus for at least 10 to 15 minutes. Do not move your hands, do not move your head. It will reset. When you get up, 2 sets of switches in every muscle. One turns on if you move fast, one turns off, and lengthens if you move slow. That's the one we want. The Golgi's tendon organ, the GTOs. Bring the feet down slowly. Can't stay slow fast enough. People tell me I'm fast. That's what I do. I move fast all the time. Guy did that years ago. Then he called me around Christmas from the emergency room. You got to help me, my back's out. And I saw him late that evening, and I said, you know why I'm seeing you this late? Because you like me. No, I want to know how fast you're moving. I told him I was going to bite him, and it did. In this position, using a little gravity and weight, we roll to our side and let our legs fall off. The weight of our legs helps us come up. We breathe in the nose, all the way up, and we sit for a second. And we turn the feet in, lean forward, breathe in the nose, standing, and give our body 10 seconds to calibrate. This is how you turn off crippling back pain. This is one of the few times we use the microwavable heating pad. You can use it across the stomach, or you can use it laying in the back. But do not lay on heating pads that keep generating heat. They will make the tissue swell. That information will get you out of some crippling pain. Take it for what it's worth. Years of information. Now how to use our system. First, how you get on it. Hardest part is getting on it. People don't know which segment to do first. Well, the first segment is, it goes through your shoulders, right through the tip of the shoulder blade, which is that very tip. They call that the inferior border. Goes right in the middle of this bolster. Acts as a rocker system. She's going to lay back on this until her shoulders hook into it. If you will, lay back, please. She'll scoot back until she kind of feels her shoulders hooked into it. I'll test it, and I can see that that is correct. Raise your legs. It helps if you preset yourself on this. Normally you have this bolster where you can grab it with your legs. At that point, all you have to do is take one of these and put it long ways so that your sacrum lays on it. Again, that is a big magnet. Depending on the size person, or if you're going to actually lay on it for a long period of time, is how much more you want to add to it. You can add 2 more of these now in this configuration. So you have one for the sacrum here, and these 2 are stabilizers. They keep you from rolling. And before you get on, you might want to consider putting your ground on first. And you can put 2 of them on. Theoretically, it's going to charge twice as fast, but I can't prove that. I don't know how fast can you move electrons to what gauge wire with how much magnetic pull. Don't know, just know it works. The last thing is one of the hardest things. Depending on the size of the person, if you have a lot of kyphosis, you probably want to add your pillow, which is a memory foam pillow, and then we want to add our traction pillow. With this traction pillow, we have a couple options. We can put the magnetic core inside of it. Raise your head and back down. And we can go through the standard exercise of doing nothing. Let your body shape just change. Bring your arms to this position and let your body shape change. If you want to take the kinks out of your butt, all you have to do is cross your leg, bend the bottom leg until you have a nice firm pull in here. Remember, the connective tissue molds, so just wait. And time and gravity will pull that kink out of your butt. Because the body collapses to gravity, you've got to see straight. So you look up, your shoulders round, your back bows, your hips turn out, and then these tighten. And that's why you have all this misery. You can add a full curriculum of exercise while you're in this position. You may choose to exercise with this staff. You'll hold on to that sleeve and to that sleeve, holding this straight out in front of you, holding this together. You simply twist this device, keeping the head and everything down tight. You can get a full workout. It can give you an aerobic workout. It can pull the kinks out of your shoulders. So you're drawing that magnetic charge at the same time that all this is happening. The harder you push in, the more it will work you out. It will sit here and actually just crank up your abs because there's a band that goes between the hip and the shoulder. So another alternative to this is taking out the magnetics. We'll hold that, please. The sleeve of the magnetics is about the same size as the center sleeve on the staff. You place it together, bring the ropes till they come together, and again we're going to put, raise your head please, traction device back under the neck. This now will allow us a whole nother dynamic of movement. We can do the same thing here. We can push this together. We can do that same exercise. We can hold it right down next to us. And in this position, it will just sit here and crank your abs. So it's a powerful exercise. You keep it together, and you crank into it, and you're doing isometrics. You now have this staff to contend with. So the exercise procedure is as follows. You hold a position for 10 seconds. Once you've engaged all the various positions, you hold them for 10 seconds, relax for 30 seconds. Do each one for about 5 minutes. One side consists of the leg rotated and stretched on this hip, and one of the other. That's 10 minutes there. The standard position for this is, hold this behind the head. Depending on how much you want to work at it, keep it close to your head or far away. But if you do it far away, you reach out until it tightens right here. You push it together, and that's 1. That's good. Just hold right there. I'll hold it. 2, you squeeze your buttocks. 3, you hook your heels. Bend your legs. There you go. Like you're hooking. 4, you engage the Kegel. 5, you engage the middle ab. 6, the upper ab. And 7, you lock the head straight back into a dural tube extension. Your head and chin go straight back into a wall. You hold that for 10 seconds. You count from diaphragm 1, 2, hook buttocks, 3, hook the legs, 4, engage Kegel, 5, take the middle ab, 6, the upper ab, and 7, lock the head back and release. And that is found in your core correction regiment, which is another segment. You can do this prior to doing the core correction. How much of it you want to do is up to you. You also have the choice of capturing this device, knowing what that dural tube extension does. It locks the sacrum and the sphenoid bone, therefore extends the dural tube. So again, you can push your head back down, you can tighten your abs, you can hook your legs up, there you go. Hook the legs and just tighten the entire structure. While you have that, you can rock this staff back and forth and literally traction out various parts of your neck and shoulders. You can feel where this will traction. So that's a dynamic thing that you can do with the staff. There are a lot of variations. You can take the other staff, if you're so inclined, that has the big magnetic core on it, and use it as an isometric exerciser as well. A lot of variations. The key is traction the neck, decompress the shoulders, decompress the low back, and relax the low back and lengthen the body. If you make it longer, it will work better. You can, if you would like, at any given time, take this heating pad and heat it up and let the lower structure relax. As long as it's laying on you, no problem. It will actually help you with its weight a little bit, gives you a corset effect, allows you to tighten. It's important to do the moves individually. The head is last because the band that goes from the sphenoid to sacrum is engaged when you squeeze the buttocks, tighten your core, the kegel pelvic movement, the abs, and last, push the head back, and it draws that band that goes through the body. That's what we're trying to reach. That's why you will maintain being longer for a longer period of time. So the average lay in this position is about a half hour. The arms are always up and back behind you, and you're lengthening. And every 30 seconds, you stop for 10 seconds, and you do this engagement of movements. And then you relax. If you've covered 15 minutes of it, it will have been a pretty good piece of exercise. For the therapist now, what we're going to do, practical application part, we're going to reach under the ischial tuberosity, around it, and capture the sacrotuberous ligament with our fingers, cupping it. When we have that leverage point, we'll reach across the body, under the ribs, creating a diagonal movement, knowing that there's a spiral band going through the body. So we're affecting what's called a spiral band. In one movement, we'll be able to reflex the sigmoid colon, the psoas at the ileocecal valve, the gallbladder, the diaphragmic connection, the turn of the colon. All these areas will be able to be reflexed. You'll be able to traction up uterus, you'll be able to traction up bladders, and do all that with one simple movement through pulling and creating a traction through the body while she's in this position. I can have her assist me simply by pushing the head down and moving the staff until there's a pull to the area that I'm trying to pull to. So as a therapist, it gives me a lot of work. I can do it one time. I can go get coffee and come back and they'll be straighter and charge them for that. But I wouldn't feel good about that. We make a real money from all the sounds people make. I always ask them, you know why we have this magnetic exerciser in the sleeve? And they say, well, you know, so magnets don't get on you. No, it's to cover the teeth marks. They look terrible. All right. So from here, we can add this magnetic induction. No sense wasting anything, you know. Hey, head back down. Thank you. Thank you very much. Testing with the ropes. Took 10 years to figure out that little pillow. Hooking the ischial tuberosity. Put it in the tip of my hands. Reach across to the ribs. And be careful around barrel-chested people with floating ribs. You'll pop them. And just drag. Nice archer stance on my side, and I use the weight of my legs, and work your way through that. You can do it from there. I like working a lot with my elbows. I can reach in traction, pull down hiatal-hernias. I can reach in here and reflex gallbladders, ileocecal, sigmoid. You can do all that while you have this giant leverage working underneath you. And all this leg is doing is creating a nice leverage for me. So that works this spiral band. You can then internally rotate the leg, knowing that one of the biggest lesional problems in it is around the head of the fibula to the tibia. That has to articulate. Use a cupped hand so you don't compress the peroneal nerve. Reach down to the ASIS. Get into a good archer stance. And because they're floating like a bag of water, you can just wait and these areas lengthen. You can't stretch the IT band. It's a non-contractile tissue. The only piece that stretches is the TFL, tensor facet latae, that piece of muscle and the attachment. What you're seeing at the TFL, the gristle that people see, is the outside of a sluices of cavities that encapsulate the muscles themselves. So this movement will help lengthen the IT condition, working on it more strategically. Don't grind it, don't iron it. It's not nice on them, and it's not nice on you. Do each leg, and keep making circles while this body's changing shape. Now we want to take the superior border of the scapula, the medial tip, being right in here. And everybody knows how miserable it is to reach this spot. Because she's on a bolster, I can reach this spot, move the arm back and forth, and it will create an excursion of the scapula that allows me to reach that nasty little serratus posterior superior that people always complain about, and break loose the fibrotic condition that occurs there because it's trying to hold your head up. We hold our fingers in here, and we simply let it press by using this fulcrum. We call these Jesus spots because people call upon His name. Some people confess sins they have not yet committed. It does wake you up. But it's important to break it loose. So just sit here and keep working it till it becomes compliant. That's a nice word. I like using these nice words. We do that to both sides, and we work around back and forth, these four corners. That changes the body structure and flattens it out. So it allows you to elongate. What else can you do? Obviously, you always want to work the ribs from here out and move that latissimus back as much as you can. The tip of the scapula tends to get adhered to the latissimus, and it pulls you to a constant power stroke. Being a swimmer, that's what you wind up with. Not what you want to see in people. People blame it all up here, and they don't see the latissimus is hooking you like that. So now you have an exercise curriculum that you can do lying on your back, and you have a therapeutic curriculum as a therapist that you can do any number of things. And we take this out. And again, we have our traction pillow. We have them do all the engagements, squeeze your buttocks, hook your legs, lock your head down, and all I have to do is grab these ropes and pull and just hold and go skiing very nicely. Know that they are not an endangerment area. They're not around the vertebral artery, which is adjacent to C3. Stay off that spot, please. This molds to the base of the occiput with light body weight. 5 pounds, 20 pounds, doesn't move 5 minutes while you're trying to rip my head off. But you can have them articulate into a dural tube extension, tuck your chin and head down and hold for 10 seconds at a time and release. And it gives you such a nice correction of this longitudinal ligament going down the back. So at this point, we come out of this position, and we will go into a prone position showing the variations that are possible within this kit. Again, you're going to roll to the side, drop the legs off, breathe in, sitting up, bag of air picks up a bag of water, and she'll turn the feet in to stand up. Now, if you'll step to the side, we'll show them this variation. This is a variation now, depending on what parts of your kit you want to carry with you. If you do alcohols, you may or may not want to carry all the big pillows. Some people don't. For a prone position, you can create a bolster position across the chest and a forehead position here. And unless your feet come off the end, you can put the feet on this pillow. Now on our table, obviously, we can go off the end. But if a person is doing this at home, they may not be doing that. So, for a male, we will have this set up. And we'll have these two on the ASIS bones. And they act as what's called SOT shims. And that floats the body in this position. Females don't like that much weight on them. And for them we have a triangular donut. It has a breast indentation, just enough pressure to hold you up here. So that I can use that for men and women. I tend to just do it this way. Using this microwavable heating pad, I can roll it up if I need a thicker structure underneath the chest, and I may not use the magnetics. For her, I'm going to put her on this, We're going to put this in her hips like that, and she's going to be lying face down. Since her feet go off the end, we won't have to use that. Okay, if you'll come over and lay down on this for me, please. Put your collarbone right there. This goes into the hips. It suspends the hips. So in this position, the original video 8 years ago showed you use a hip bolster to float your hips. You can accomplish that with these magnetics. Other things you can do, obviously. You can hold on to this. Put your ground on, and you can pull a magnetic charge from your head through your body and relax you and do what's called still pointing, resetting the spinal pulse. What else can you do? Wait, that's not all. There's always something we can do. We can take that and actually work on low back problems by going into extension. Helps to have someone do this for you. If you'll reach back and drop your arms around, I will put these sleeves, hands face down. There you go. No, I didn't prep her for this on purpose to show you that anybody can do it. She's going to just close her eyes and slowly raise just the upper body. And when she hits her limit, she'll open her eyes and suddenly it pulls her up further and then release and go down. So this magnetic work is done every 10 seconds. You can reach out and capture it. And you can roll it up and down your back. That creates an electromagnetic field. Again, you're back to keep this next to you. Make it stronger if you want to make it stronger. Now you've got a huge magnetic field going through you. This is about decreasing depression and stimulating the neurons in your head. So you can at the same time rehabilitate yourself with McKenzie's work. All that's happening. You're doing sacral decompression, still pointing, electromagnetic induction, and low back herniation correction. A lot of things you can do at one time, obviously. As a therapist, what can I do? Well, back to practical application. I can look simply by turning the leg in this position and see which hip is too high. Then all I have to do is make it flatter. Don't worry about what muscle. Work through the sacral edge, work through the ilolumbar ligament, follow the gristle, follow the back spiral line. Whether you use your arms, whether you do simultaneous work, they turn to you and you go through the low back and neck at the same time. If you grind down, if you go through the ligaments, imagine all the ligaments all the way down through sacral tuberous. If their legs don't stay in good compliance for you, you're going to do this a while. Take a big piece of Velcro, place it on top of the knee, preferably soft side into their feet, cross the leg, strap it down, and do not ask them, can I strap you down? Because what kind of a fool is going to say, oh yes, do that please. Not. Now to keep them in perfect position, I ask them to reach out and hold this. Now they have all the magnetics. I have them locked into a set of handcuffs that I can sit here and work this entire spiral line through the back, the lumbar, sacral edges. You can double this on the legs and it looks rather obscene, like a little froggy position, but I promise you, you can break loose tremendous problems in the sacrum if you just flatten it out and make them equal. Don't go stupid. You can reach all these spots that you already know how to reach as therapists, but it gives you tremendous multiple capacity of work at one time. I like dragging through the back, going through here, telling them to close your eyes, raise your head, turn, breathe out. You're going through all these active engagement movements while you're doing everything at once. Flatten it out, quit worrying about what muscle's doing what, and start thinking about a bag of water, gristle, that you're molding into shape. The correct shape equals usually the best movement. Not too hard to figure that one out. This is rocket science. So that's the practical application of the prone position. come up on your hands and knees slowly and sit up facing over there. Normally I tell people face the music, which is where it's coming from. And so we go from that position and we recalibrate the writing reflex. Last thing we do. To do that, we use an interesting phenomena. If you hold a stick of any type, obviously, behind you, if you've ever gone hunting for a day, at the end of the day you're holding your shotgun about like this, just trying to keep the weight off you. Now your shoulders turn off because your hands drape over this. But your head turns on. So when the cervical component turns on, that engages the optics, and the writing reflex tries to reset you, pretty much like a C1 adjustment does in chiropractic. It gives you a very similar sensation because you're recalibrating the eye position. So the whole point is, if you're draping, you're resetting the head. If you're holding, you're turning on the axillas. Just know what muscle group you're working with and what you're trying to accomplish. Here, after this workout, you get up and you reset the writing reflex, and that makes you straighter than anything I can do. I would straighten people, and they'd feel good, they'd look straight, and I would do that, and they'd be straighter, and I was kind of insulted, you know. I mean, I think I'm pretty good, but nothing beats the writing reflex. God made it that way. Okay, if you'll come over and sit here, please. In fact, we'll sit right there. Put your feet firm on the floor. Basically, you drape your hands over sleeves. The sleeves are loose and they rotate. Once you lock down to it, you start rotating after finding an optical point in front of you. You start rotating 1001, 1002, 1001, 1002, 1001, 1002. And you pick up a little pace that just fits you. While you're doing this, then you'll close your eyes for 15 seconds, memorizing the optical point in front of you that you were looking at. Often I tell people, put up a little shaving mirror, something about look the person in the eyes. And then for 30 seconds, open the eyes and go through a regimen of 15 seconds of closing, 30 seconds of opening, and do this exercise for up to 5 minutes. When you've concluded this, you simply stop, relax, let the arms drape off, you turn the feet in, and you stand up. And this puts you back into a real strong neutral calibration. From that, one more thing that we do want you to know is how to elongate the body to take the pressures off those herniations and bulges that people talk about. The core shortens, the connective tissue shrink wraps it, and now you're stuck. A very mild traction, expand the connective tissue, then recalibrate the primary flexor, which we've shown you is how you turn off the back because it turns off all the neurology to the lower lumbar. Do those two positions and get up, and a large percentage of people have bypassed back surgery doing this simple procedure. I want to share it with you. The secret is know how to cook. Do not get on your feet once you've done the first part until you've done the second part. It is a cooking formula. The first piece expands the connective tissue. The second piece recalibrates the primary flexor of the muscle. When they come back online, they match their expansion. When your feet turn in, your body calibrates your bias, and you are taller. And the gristle has less pressure on those nerves. And they quit saying, "Can you hear me now?" So, when in doubt, if it really hurts, always turn your back off first. Fetal position is your godsend. When you can tolerate it, do it this way. If there's a sway in your back, it will not work. It must be a nice clean line as though you're laying on a plank. Gravity does the work. Talk to Jesus. Works for everyone. You'll come put your knees here and lay over this, please. We built up the array of bolstered materials that we use in our kit. It should feel like you're sliding, and every so often you will have to readjust yourself to gravity, kind of like a day at the levee. You ever fly a kite on the side of the levee and you're laying on the levee, but by the end of the day you've slid down that thing. It's amazing how you just creep right down. So you want a complete line all the way down, about 30 degrees for most people. How do we know if we have the right amount of slough or the slump for the connective tissue? Well, the test is every 5 minutes you reach your leg to a bent position and you rock it back and forth about a half a dozen times, and you let it fall back down. And if you've done both legs, at that point the weight of the movement will have made you elongate and slide down. I call it shaking out the bones. An old man taught me this. He used to go between assisted living and a Walmart and fall down the ditch and knock his hip out of place. Mid-80s, poor thing, nobody could work with him. He was so frail. And I said, Lord, let me help this man. And I got to thinking like an 8-in tractor, and it just need to be split just a little bit to break the gears loose. Well, you take this, you let the gristle expand. The gravity, it doesn't fight and guard. And you rock him back and forth, and he goes ka-clunk like the old 8-in tractor, and he was good again. But I learned you don't get on your feet from here, because once you've loosened up the gristle, the connective tissue that's housing that muscle, you've taken away its shell. And if you step on your feet, it's going to go dog food and tighten up. So, keep away from the guarding mechanism. You lay like this approximately a half hour. Every 5 minutes you rock your legs back and forth. From here you crawl onto your back. Do not get on your feet. Get your legs in a fetal position to reset your back. Turn your feet in to stand up. And this is the information that you already know from previous video. The woman's structural health massage. With that, we tend to go through and add a lymphatic component. You can start out in this position. You can, because you're bolstered, take one hand following the ribs, and one hand following the ribs, follow that rib line, and go into a pumping action. And you can do that action on both sides. Because of the extra leverage that you have here, because of all the padding, it gives you a really nice pumping action. So, keep the hands cupped, follow the ribs, and do your first pumping action, usually about 5 minutes per side. I normally start with the liver side and then work my way to the spleen side. That would be the way I would do it. From there, I would simply have to change position to go into a sideline position. Take this out, you take this out. You'll breathe in, come up on your hands and knees. Allow me to take this out. And it's a cute little jigsaw thing we can do here. You're going to lay on your side with your back to me. That goes right through here. And the arm falls into this little pocket that the pillow makes. Bring it down further, all the way down. Raise up. Try to put it between the ribs and the hip is where you're trying to put it. Bring the knees all the way up to you. Full fetal position. Bolster the legs. Really take a magnet and put it right next to the buttocks and gives her a real solid sensation of something that she's laying against. Then we give them a scepter, because every princess should have a scepter. I don't know about the princes, but we're going to give it to them anyway. We can call that something else. So in this position, you can, if you like, add some pillow between the legs. Depends on how bony they are. But you simply do the same cradling action with your hands, a nice V. You capture under the ribs, knowing where the organ is, and you're pumping the ribs. And through the ribs, you're pumping into the liver. If you do it to the other side, you'll be pumping the spleen. A nice 1001, 1002, 1001, 1002. And you can get up to 180 beats a minute on a thymus, is what they're telling me. That's a lot of action. So that would be another lymphatic pump, and you would do it on both sides. Not too much rocket science here. The ground is on, they're charging magnetically, and you're pumping the immune system, which can generate up to 2,200 leukocytes per milliliter. Obviously, from the biopsy, that information came to be. Now we're going to lie on our back, and I'm going to take this little stabilizing magnet out from the buttocks. Makes you feel safer, doesn't it? And breathe in to come up and roll on your back. I always tell these people that have weight on them, breathe in before you try to move. The dead bodies have no air. That's why they're so hard to move. And again, we're into the position we had started with before. Raise your head, please. We lay back on this bolster. We put ourselves on the leg bolster. We raised our buttocks. Put that right into the sacrum. When it felt solid, we pulled the big pillow into us to tighten everything up. And then we can put these little hip bolsters in place. And we have our ground on. We want to add our traction. And we test the neck. Sure she's bolstered well. Place the hands right in here. If you're heavy chested, you're going to have to hold yourself in place or you'll bounce all over. So, regardless, it's more comforting to hold here. You can put your hands into the ACES points here, which will create a pumping action in the axilla, in the inguinal nodes. You can place bottle of water, hot water, again into the inguinal area. Whichever side of the bottle fits best your hands is the side you hold. So at this point, my thumbs follow the clavicle. Sitting in a cupped hand, everything is always cupped. There are no hard hand positions here. And I go into a pumping motion. Now there's heat in the inguinal nodes, and her job is to kind of push down into those a little bit with her hand and feel the pressure transfer to the arms. So she's pumping one end of the nodes, and I'm pumping the thymus, sending T cells into the spleen that turn to leukocytes and increase by 2,200 per milliliter, which is supposedly pretty cool stuff. Makes you feel good. You can also add these bottles to the axillary areas. You can take one apiece so that they would lay out like this, a little towel around them. They're always wet towels. You want to use wet on skin. Don't want to go through baggies. So you could do the same thing here. Another wet towel around this hot bottle. And you want this directly on your skin because the water permeates the tissue and creates a hydrostatic pump, which is not the same as being turned on through this conductive heat through chemoreceptors that just make you feel hot or cold. Same thing with that. So you can pump and add heat to the axillas and the inguinal areas at the same time and get this motion working. You can also go back anteriorly, same cupped hand, and do your pumping. This person's floating, if you hadn't noticed yet, they're totally floating. If you have swelling, you would take wet hot towels wrapped around very hot microwave bottle. You place it behind your knee. You place another one again over the inguinal nodes. And you would place a cold rag around the foot, like an ice rag. So I would wet this and freeze it and fold it up, and I put it around the foot, and I would let this drain with that swelling, and I could set up all of the different heat points that I just showed, and this pumping would literally pull fluid out of that extremity. I can do the same thing here, simply having them hold using your ice rag, and again, that heat, that inguinal margin, and that axillary margin, inguinal axillary, I always confuse the words. It's hard enough to learn English, you know. Medica's been good to me. German immigrants. All right. Same thing, same pumping action. Put your heat everywhere you want it and make everything drain. How simple that is. It is when you know how it works. The hot and cold applications of hydrotherapy are very powerful mediums that a lot of therapists never take time to really learn well because it is a little confusing. But once you get the information and understand it, then it's a powerful modality. The other thing you can do is lymphatic brushing. Different brushes afford you different textures. This is a much more rigid one. This is a much more soft one. Doesn't matter, it has to create a squeegee effect. That's the brush, and while you're looking at it, the way it is, a good drafting brush usually works. You always go proximal to distal, so if you put your heat in correct regions, you start brushing like you're chipping sand, basically. If you ever played the sandbox and worked around doing those sand castles, you're chipping it away like this. And you go proximal to distal, and then eventually just make long running lines. You can do that for the lower region. You can do that, same thing in the axillary areas. You can drain. It doesn't take much. Remember, the vessels are just under the skin. Too much compression compresses the vessel, and it takes 24 hours to reconstitute. Ideally, starting in the morning, if you wear the ground at night, your lymphatics will be improved. You'll have more lymphatics in your face. Put the heat in the axillas, wet towel, sit, start brushing. And you're chipping as you're brushing. And then finally you'll get to where you can bring, and you can almost imagine the fluid flowing. Those lymph nodes that drain in the skin under the neck. It's a very powerful modality. You don't believe it until suddenly you say, wow, those micro cracks are filled. How cool. How long? Yeah, well, it's a cheap thrill, but hey, it's better than nothing to get you by for the evening sometimes. Give you a quick facial. And it does. It gives you the rosy red cheeks of little children, you know. Moves that fluid, looks smoother. So you can do that with lymphatic brushing. So now you see how to drain, you see how to pump. You can take all the structural pieces that are in the previous information, and you can go through that. How much of it you want to do is up to you. You can do the visceral work we talked about. You can traction with your arm just above the ramus and your hand on issue tuberosity. You can traction the bladder, uterus, prostate conditions, all types of colon conditions, traction stomach, hydrohernias down, and everything else up. And all you have to do is know that you're using a leverage system on a bag of water. If you get this down, you'll get a lot of results for people. And that basically is it. That's a woman's structural health massage. Any questions, please come in and get some private training, and let us make you a specialist. Thank you.